Hey guys, this is Dr. Bhupesh from Dr. BKM OET Institutes, and today we are going to execute a listening that is listening part A. Normally, we don't do much of listenings, but it's good that you guys have asked me for 1 to 12, and that is what I would say. So, in the question 1 to 12, you hear about a rheumatologist talking to a patient called Harry Davis, who suffers from gout and is attending for a medication review. So review means feedback. So today the patient is asking about the feedback. So means he has come, he has come, he has come for medication review. That means he has come to provide the review of the medication, means the feedback of the medication. So he's suffering from gout. And always you should know the topic. Like you will get almost like 30 to 60 seconds. I'm not quite sure what seconds you get. But again, in those particular seconds in the start, you have to understand what the questions are. So I want to read these questions. Medical history: suffers from gout, session attack on holiday, pain in his dash accompanied by swelling. So please understand these kind of things. Obviously, it means that patient is going to talk about his symptom, and pain is in his ankle, maybe in his knees, because we know again what is the benefit. What is the benefit of understanding the word gout? And that is what I always say, that OET is something that should be taught only by the medical professionals. That is the reason, because when we get the word gout, we understand that today we are going to talk about the joint swelling. It can be joint, so you can say pain in his joint accompanied by swelling. So in front of you, I am doing this topic, and you all of you know that I would not have done this listening, but it's just to tell you how OET listening goes. So I'm just talking about this pain in his joint, pain in his knees, pain in his elbow. It can be anything. So then initially thought it was either dash, possibly related to the medication taken for dash control. So dash control means there should be the name of the disease. He must have taken some medication to control the disease, and because it is the medication word, and then dash possibly. So what can a medication do? Side effect. So means there are some words which I can fill with my common sense if I have the awareness. So if I understand the topic, so he's saying that suffers from gout, had his first attack, pain in his joint, knee, elbows, and then initially thought it was either side effect, possibly related to the medication taken for diabetic control or whatever. Describes the pain as, so we know that normally the gout pain should be, kind of a intense pain, it should be heavy pain. So describe pain as dash, was unable to walk or to do anything. Says the clinic initially suspected, so name of the disease before diagnosing gout. So there must be like something like related to bones, related to joint. There should be the name of the disease. And dash reports previously feeling similar pain after dash, but less intense, self-resolving. So he has already experienced this kind of pain which was self-resolving. Self-resolving means without taking medications. Dash not effective, medications are not effective. Colchicine is the name of the medication, maybe, or colicine, I don't know what it is. Colchicine caused dash, maybe some kind of side effect. Dash caused nausea, so name of the medication, may have overdosed. So means there are the name of the medication. So in this fill in the blanks, in the first 30 to 60 seconds before it starts playing, I can see what kind of a words will fit in. Dash quite effective, maybe the name of the medication only. Allopurinol cause dash. So these are the blanks. So this is all about treatment and the medication, and this is all about symptoms and diagnosis. So now I understand today my topic is gout. These are the symptoms, then there would be diagnosis, then there would be medical history, then there would be treatment. So now I am well aware what kind of blanks I need to fill and what kind of topic it is. So by the time you will read this, it will start playing the listening audio. So let's see what is the audio. I don't know, I'm not getting the voice of this audio. Don't know where it is stuck. Oh, then sorry. Yeah, I hope I have recorded everything fine. I hope you can all listen to me. I'm just unmuting it to make sure that you all can listen to me. Can you guys listen to me? Is it okay for everyone?
Yes, sir.
Yes, sir.
Means we have read the topic well, we have understood the topic well, and
Now, Mr. Davis, I understand your GP has referred you to me so that we can review the medications you're taking for your gout.
That's right.
So,
review the medications taking for gout. So means review means now patient is going to give the feedback. See, that is why OET is a blend of English and medical knowledge, and that is what I say, Dr. BKM. But the main thing is that I should be able to teach you those important words of English as well. View means I can see. Review, that means we are giving the view about the medications again. Review word, RE word should always be patient visited, patient revisited, patient presented, patient represented. So re word is again revise, when you revise your syllabus. In the same way, revise is a kind of a word comes from vision, revision, when you will do revision. So these are the words, that is how aware I want you to be, so that you can understand that today patient is going to talk more about medications, and the medications would be related to gout. Patient would be talking about his condition. When you understand these things, this makes your job easy. And let's see, because you all have told me that these 1 to 12 questions are difficult. Let's see how difficult they are. Let's see.
tell me a bit about this gout. When did it start?
Well, my first serious attack was last year. My wife and I were on holiday, and I woke up one morning with a really bad pain in my left knee. Well, I never thought.
Pain in my left knee. So that is what medical profession again. We are from medical professional and we know gout is like joint pain. So he said left knee. So I can easily feel it. Pain in his left knee. First blank is done. One mark collected. Nice. Let's see rest.
Gout, because I always assume that just happens somewhere like your big toe. And anyway, I'm only 40. I thought it was something only old people get. So anyway, it was all red and swollen, and I decided it must be an insect bite. But I couldn't think how that might have happened, without me feeling something at the time. Well, my wife suggested it might be something to do with the pills I take for my cholesterol.
Unlikely.
Pills, Pills. Pills is the word we normally use with contraceptive pills. We all are aware contraceptive pills means tablets. So pills, initially thought it was either related to pills, possibly uh, side effects related to pills. So side effects, my word was, so what I was thinking was correct. Side effect which I was taking for some control. I forgot the name of the disease, but it was very clear. I was taking for, just a second again. It was very simple.
Anyway, I'm only 40. I thought it was something only old people get. So anyway, it was all red and swollen, and I decided it must be an insect bite. But I couldn't think how that might have happened, without me feeling something at the time. Well, my wife suggested it might be something to do with the pills I take for my cholesterol.
Related to pills I take for cholesterol. So for cholesterol control, it is difficult because the words are not fitting in, but I can fill cholesterol, and side effects he did not say. So initially thought it was either insect bite. Insect bite was also one of the words he spoke. So second blank, I am confused whether it should be insect bite or whether I should write side effects. Initially thought it was insect bite, possibly related, but again in this problem is the these colons are not given in the best possible way. Initially thought it was either insect bite. If or word would have been given, then though it's perfect. It was either insect bite or possibly related to medication taken for cholesterol. If you get it in the final exam, this word would be clearly written or over here. So the word is missing. Otherwise, side effects word should have been there, but he did not speak about the side effect. But cholesterol control surely there. So again, let's listen to again when it is a difficult blank.
Because I always assume that just happens somewhere like your big toe. And anyway, I'm only 40. I thought it was something only old people get. So anyway, it was all red and swollen, and I decided it must be an insect bite. But I couldn't think how that might have happened, without me feeling something at the time. Well, my wife suggested it might be something to do with the pills I take for my cholesterol.
Unlikely, I think.
But anyway, the pain didn't get any better. In fact, quite the opposite. I started to get frightened because I thought it might be a sign of something really serious. It was excruciating. So my wife.
Excruciating. Again, medical professionals, we know what is excruciating pain. Excruciating pains normally happen when you have a very sharp, like needle sharp pain. So that is excruciating. Excruciating. Excruciating pain. So this word also being medical professionals, we know. So it is hard. Obviously, this kind of a hard listening should not come. And I don't mind whosoever has created this question paper, maybe this online classrooms or whosoever. My job is to teach you how, being Dr. BKM OIT Institutes. But again, the more you try, the better you get. So you should be happy to take the challenges when you are practicing so that in the final exam you can be comfortable. So again, those things, this. Let's go. Was unable to
Thought I needed to get some help. So she phoned the local
was unable to get some help. Maybe this
clinic and told them.
Sorry, I was
Thought it might be a sign of something really serious. It was excruciating. So my wife thought I needed to get some help. So she phoned the local clinic and told them about my symptoms. They told her to bring me in. It was a good thing she was there. I was in too much pain to drive. I mean, I could only just manage to walk from the house to the car.
So he was saying initially I was not able to move, something like that, because he's saying that initially it was very hard for me to get up to the car. So now, obviously, again, this kind of listening will not come. But again, it is hard, I understand, but was unable to move, something like that word has been spoken, or unable to walk. Because he's saying in the initial stages I was unable to, so you have to focus on the preposition to. That is why I'm saying each and every word has importance, especially to, for, from, by, into, in. These words should be listened very carefully. So again, hard, but let's listen to it again.
It was excruciating. So my wife thought I needed to get some help. So she phoned the local clinic and told them about my symptoms. They told her to bring me in. It was a good thing she was there. I was in too much pain to drive. I mean, I could only just manage to walk from the house to the car. Anyway, when we got there, the doctor took a look and said he wanted to take a blood sample. He said it might be an emergency because it looked as if it could be septicemia.
Septicemia. So this blank, I'm not sure, was unable to walk. Walk is the only word he has spoken. He has not talked about move. So I would say was unable to walk. That is the only word I can fit. It can be wrong, it can be right. What can I do? When paper is such hard, when practice paper is such hard, what can I do? So was unable to walk. Says that initially suspected septicemia. You have to fill some disease because suspected word, diagnosis word, assessment word comes with some condition. So condition is septicemia. Okay, septicemia means infection. Infection of the blood may be septicemia. That is why again I say that where you need medical professionals to guide you. So yeah, septicemia, let's go forward.
So then we got really frightened, but about an hour later they came back and said no, it wasn't, thankfully, but they thought I had gout. So actually at that stage we were quite relieved.
Yeah, I can imagine.
And now there is another preposition coming, after. After is also kind of a word you should always notice. After, before, under, above. Please concentrate upon these words. Reports previously feeling similar pain after dash, but less intense. Let's see.
And the doctor asked if I'd ever felt anything like it before. Well, actually, then I remembered that in the winter I play quite a bit of rugby and sometimes I'd get some soreness in the same place the day after, but I just thought I'd sprained it or something, and it would go away after a couple of days. But this pain's much worse.
After playing rugby. That is the only word I can fit in. Reports previously feeling similar pain after playing rugby. Or there was one more word after sprain, but sprain is not the right word because sprain is a kind of a pain feeling. So similar pain, so it covers sprain after playing rugby. That is the only word I can fit in. Again, can't help it when it is hard, but again I'm saying rather than checking out the answers, rather than just doing or behaving like a normal or an average student being part of Dr. BKM OET institutes, or even who are watching our YouTube videos, please understand we need to be more strong. Answers should not be what we are after. We should be able, we are here to improve our listening. That is what is the whole focus should be. So try really hard. Listen to it again and again. Do it by yourself rather than checking out answer. So in his left knee, uh, initially thought it was either insect bite or possibly related, or word is missing, or possibly related to medication taken for cholesterol control, because I understood that there is a condition that is required. Described the pain as excruciating, was unable to walk, says the clinic initially suspected septicemia. We know septicemia is kind of an infection of the blood or something, but it is septic means infection, that is for sure. Semia means mostly related to blood as far as my medical knowledge is concerned. Again, I'm also not quite sure because I've not been practicing medical for a long time. Yeah, anyhow, reports previously feeling similar pain after playing rugby. That is the only word. A dash is not effective. So maybe he, most probably some painkiller word will come, that analgesics are not effective, painkillers are not effective. Something like that should come. Let's see what it is.
It comes even when I've been resting. I've had it quite a few times since my first attack.
Right. So, what have you been taking to deal with the pain?
Well, at first the doctor at the clinic suggested I took some anti-inflammatories, but I can't say they made much difference.
Anti-inflammatory, but I can't say it made any difference. So that means anti-inflammatories not effective. Anti-inflammatories, double M. Right? All good. Let's see what college is saying or what it is.
The next attack, I was at home and I went to my GP. She suggested I took, I can't remember the name, Col something.
Colchicine?
That's the one. So that dealt with the pain better, but it gave me awful diarrhea.
Yeah.
I'd never.
Awful diarrhea. So again, awful is an English word. Awful means very bad. Awesome means wow. Awful means very bad. AWFUL. But that is what OET is all about. Diarrhea is the main word. So diarrhea we know DIA double RHEA or HOEA. Both are accepted. Diarrhea because English says this way, British English says this way, American English says this way. But again, spelling should be DIA diarrhea. DIAR something, whatever I spoke earlier. Otherwise, I can write it for you. Yeah, I will write it because I'm better at writing. Yeah. DIARRHOEA. Yeah, something like that. Cool. So diarrhea. My spelling can also be wrong, but again, I'm telling you. But if you are taking your exam, you cannot do these spellings wrong. I'm sorry. Means I'm not taking OET exam, but I'm teaching you what you can listen to. But in final exam, you can't do this spelling wrong. That is not accepted. So you have to practice. Right? So yeah, from my side, I tried my best. Let's see how it goes further. Okay. Playing it again. Let's see. So now I am worried about the name of the medication. That is what I'm after. Which medications overdosed?
It again. And then I had a really bad attack. I think the doctor had got to the stage where, she was already giving me really powerful medicines to no effect. So she gave me liquid morphine to take.
Liquid morphine. Again, being medical students or medical people, we know that morphine is the drug. That liquid morphine. Morphine is the drug that is a serious painkiller, which normally is not now acceptable. It's given only when nothing is working. So morphine, yeah.
Made me feel quite sick, actually. And I was a little bit...
And in English, whenever patient says sick majorly in foreign countries means the stomach is upset or something like nausea has happened. Sick is a feeling of nauseatic or either something has happened to stomach. Means sick, we normally say I'm sick, I'm going for a sick leave. Normally sick does not mean kind of flu. If they're having some nasal symptoms, they will call it flu. So it is sick means that he's having some nausea or maybe some kind of stomach upset.
With theories, walking around quite knowing where I was.
So again, I have to mark a medication that should be effective.
Right. Did you try any other sort of treatment apart from the medications?
Yes, my GP said I could try using an ice pack, and that did make a
Ice pack. Again, pain, joint pain, ice pack. Again, is the solution.
bit of difference, but you can't have it on all the time. So anyway, after that, she said, let's try allopurinol, see how you get on with that. So I started taking that, but I didn't get on with it. It gave me a skin rash. So I rang her up.
Now, seriously, guys, now it's you and me. You will let me know how many blanks I have done wrong and what is hard with this listening. Please let me know, because I did not check the answer. You guys have the answer as well. You need to tell me what bothers you. So please, I have unmuted you and you can help me and understand what's wrong and what's right. What do you say, guys? First, left.
Only two, sir.
Only two are wrong.
Sir.
But I would still be upset two are wrong. Okay. So left knee is fine.
Two wrong.
Second answer.
Insect bite, sir.
Insect bite.
Cholesterol.
Yes, sir.
Yes.
It's also fine. Excruciating.
Yes, sir.
Unable to, because I could not get. But walk is the only word I could get. Unable to.
Drive, sir.
Drive, sir.
There was another, because I was looking. See, that is what it is all about. I was looking out for a verb. Verb means, what does a verb means? This is also one of the rules of English, that majorly after two, you will have a verb. I am unable to do this work. I am unable to go to park. I am unable to play. So the only verb I could listen to was walk, but you are saying there was a drive word as well. So yeah, that's my mistake. But again, it was hard blank as well. So can't help it. So we can afford, which are really hard. But yeah, unable to drive, because I did not, because he was saying I was unable to drive my wife. Yeah, maybe, but hard.
He told me to stop taking it.
Okay, sorry. What's the next one? What's the next one?
Six, sir.
Sorry?
Septicemia.
Yeah, that's
Septicemia.
and septicemia spelling Septicemia.
Yes, sir.
Yes.
Reports previously feeling pain after playing rugby or after sprain, something like that. But yeah, you can let me know.
Rugby.
Playing rugby.
Rugby, sir.
After, but again, in the final exam, when you get it, so this is also, these are the rules of prepositions. Like, see, I do my exercise after getting up, means afterword normally is followed by a noun, means after cricket I will play basketball, so cricket is a noun. Or after this word after, there can be gerunds. What are gerunds? Gerunds are the verbs which comes with ing and then they start behaving like a noun. So after playing rugby, after doing this work, when we do speaking, we say after examination or after examining you. Means after the word after, you say after examination, noun, or you say after examining you, after assessing you, after assessment. So these are the words. So in this blank, after rugby is not good enough. So you say reports previously feeling similar pain after rugby or after playing rugby. After rugby is also looking fine. So even if rugby is given as an answer, wow, after playing rugby would have been a better answer, but after rugby is also fine. It's fitting in. So you need to fit in. Reports previously previously feeling similar pain after rugby or after playing rugby. Both are correct. After rugby, we will do fine. But playing rugby, I would say, is better. Okay. Dash not effective. Anti-inflammatories.
So
Anti-inflammatories. That should be fine, I guess. Oh, I have to unmute you. Sorry. So after, sorry, this anti-inflammatory is not effective.
Yes, sir.
Yes, sir.
Cholesterol caused, what did I say?
Diarrhea, sir.
Diarrhea.
Yeah, what's
Diarrhea.
the diarrhea?
Awful diarrhea.
Awful, so again, awful word you can miss. Again, I'm saying, but I am good at English, so I could listen to that word. But if in the exam you are not listening to the word awful, it would be given in the bracket. So means like in this playing word was given. So if you write it, you still get the marks. If you do not write it, you still get the marks. After rugby, correct. After playing rugby, correct. Caused awful diarrhea or diarrhea, both you will get marks. So diarrhea, DIARRHOEA was fine.
Yes.
Yes, sir.
Okay, please. That is why some people may be doing very well with their listening. Sometimes spellings can be the key. So in the part C and B, do one listening 3 times.
Here I am.
Sorry. In the part B and C, do one listening 3 times because you have to use your analytical thinking to mark A or B or C. But for the part A, do one listening 2 times, then check the answer. One listening 2 times, then check the answer, and do as many listenings as you can to learn as many spellings as you can. If you do any spelling mistake, write it 5 times. That is how the improvement will happen. If you are lacking marks in listening, do one listening part A 2 times, then check the answer. After checking the answer, any spelling which you have done wrong should be written 5 times. That is the real way of practicing listening if you really want to pass. If you want to pass your time, not OET, then it's your wish. If you want to pass OET, minimum 2 times. Take it to perfection, guys. Then where are my 2 blanks wrong? It's 1 until now, and that 2 was hard. Collision course maybe okay. Let's see how far do we go. I still would like to listen to your voice. Would like to know what's the second one which I have done wrong. Okay. And collision caused diarrhea. Okay. Dash caused nausea.
Morphine.
So liquid
Liquid
morphine.
morphine.
Liquid morphine was also correct. Yeah. That's again whether you write liquid morphine or morphine is the noun. Liquid is the kind of an adjective that's telling that it was in the liquid state. Okay, so that's fine again. Main word are the nouns, diarrhea, morphine, and in this rugby. Okay. So now dash quite effective.
Ice pack.
That also is wrong. Oh, right. Where is the allopurinol caused?
Skin
Skin
rash.
rash.
Then what
Rashes.
Skin rash.
is wrong? Why are you saying 2 are wrong? Clever people. All right. Okay. So I've recorded everything for you.
So
Listen.
the one was insect bite and second was walk.
No
In-
insect bite. Right. Again,
yes.
I have recorded this video. You can do it again. I told you if or word would be given, then definitely
Yes.
right. But or word should have been given that this or possible because if I'm just gonna take you to just a little bit of again these are the rules of English where prepositions to after whenever there is a word either. Let's go to this thing either. I will show you here. Okay. Just a second. Either word, if even if I write just like that, either, it normally will come with or. Normally. Either usage. I will write it either usage. Either used when a choice between the two. For example, either one deserves to win or means most of the times either word will come with or. So there should have been given or something like that, but it was not mentioned. That's where I got stuck. So only one blank is wrong, guys. Why do you want me to make 2 wrong? So I'm happy with 1. So this is how you do OET listening. Again, see, the problem is not that you asked me to do OET listening part A, but I'm saying you can do it yours. You just need to listen to it again, then again, then again, until you get at least 10 out of 12. I know this kind of listening will not come, but do it again, 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 if you really want to pass. These listening practice papers are blessings. They let you know how better you can go, how far you can go. So don't get carried away. Oh, I did listening once, sir. I got only 2 out of 10. So I gave you orders because I paid you. So I'm giving you order that you have to do it for me. Otherwise, I will say you are not a good institute. ऐसा नहीं होता है. It doesn't work that way. If there is any listening that is hard, you do it again. Do it again. You do it again until you learn yourself. I am there to guide you when something is not working for you. So this is Dr. Bhupesh once again from Dr. BKM OET Institutes. Thank you for listening to us patiently. Our contact number is 76967 34256. You may call us for the best OET coaching. Thank you.